Hi, I'm Lizzie. I'm a specialist neurological physiotherapist working at Hobbs Rehabilitation, and over the last 3 months I've been working with the robot. The robot is a robotic device that we can use to train the upper and the lower limb. It's versatile in the way that we can set it up and use it within a therapeutic setting. The robot de-weights the limb and supports the movement much like a therapist, but we can complete a much higher volume of repetitions with the robot. The system software has been well designed and has taken into consideration both the clinician and the patient in the way that it uses its display as well as audio cues. Over the past few months, we have all got quicker and slicker at setting up and using the robot and have been enjoying more creative ways of using it within therapy sessions. When we've been using the robot for lower limb rehabilitation, we have found that it's really beneficial to give some real-time feedback for patients. So we not only see what the device tells us on the screen, we can also look at the EMG traces when we're using it in the sense and stimulate mode. So with the lower limb, we have also been using it with resistance and working on specific ranges to help target patient goals. We can get a high volume of repetitions in within a session and get real-time feedback around how hard someone is working. Following the session, we can look at the data that the robot has on screen to see just how hard someone's been working. We've been using the robot to train the upper limb in our patients, and we have noticed that they really engage with the device. It draws their attention to their affected limb and means that we can create a higher volume of repetitions for people within their sessions. They also show that they hold their attention better with the robot over the longer period of time. We've started to explore more functional and meaningful movements with patients with the robot, for example, replicating an archery draw as well as golf swings. One of the big benefits of the robot is it's freeing up the therapist to be able to observe the patients as well as then provide verbal and tactile cues to aid in the quality of movement that patients are achieving in their sessions. Overall, using the robot for both the upper and the lower limb, we've seen that it really helps with patient motivation and engagement. The robot is at the forefront of robotics in neurorehabilitation. Its versatility and usability add value to treatment sessions for a variety of neurological conditions. We look forward to continuing to embed the robot into our clinical practice and seeing our patients engaging in meaningful and evidence-based rehabilitation.